Hi, I'm Dr. Scott, and today I want to talk about some of the common thyroid frustrations that my patients have expressed to me. So I've been in practice here in Virginia Beach since 1996. I'm the founder of the Total Health Center, and I'm very excited to be finally making this video today. You see, my job is to improve people's quality of life, and when I improve their life, it actually improves my life. So I'm very fortunate that way. I see a lot of thyroid patients in my practice, whether it's hypothyroidism or Hashimoto's, Graves'. Many of my patients have been to multiple specialists here in Virginia Beach, as well as Johns Hopkins, Mayo Clinic, and I really truly enjoy working with these patients because we're able to help patients who couldn't previously be helped by their doctors. So here are some of the top reasons most doctors are frustrated with the progress of their thyroid patients. Number one, just looking at TSH or just really having a drug approach to the treatment. So the standard of care in our current system is to look at something called thyroid stimulating hormone, or TSH, and depending on what the value is, recommending some type of medication to try to bring that value back into normal level. So for many patients, that's it. That's the answer. And most doctors and most of their training is consisting of looking at TSH and recommending some type of thyroid medication. But this really doesn't address the cause of the problem. See, as I mentioned earlier, I treat a lot of patients who have been to a lot of different specialists, like I said, even Johns Hopkins, Mayo Clinic, and the thing I have to help my patients understand is that these doctors are experts, but they're experts in drug and surgical treatments of these conditions. This is a very key distinction that many people don't understand. The medical community has put themselves out as the end-all, be-all to all health-related issues, but the truth of the matter is that they are specialists, and they're specialists in drug and surgical treatments. All of their continuing education, even their basic education, is centered around a basic philosophy and paradigm of treating disease, and specifically treating disease with drugs and surgical interventions. So this is the number one frustration that my patients have, is they're looking for an answer to why they have this problem, not just figuring out symptomatic relief, which is important, but again, many patients aren't even getting that symptomatic relief with these medications. So a good analogy I try to help my patients understand is that when you go to your doctor and you're frustrated because they're only recommending his medications, it's really not fair, because that's what they're trained to do. So a good analogy is if you went to McDonald's and asked for a filet mignon and you got upset because they didn't give you a filet mignon. I mean, that's not what they do. That's not what McDonald's does. So when you go to your doctor and you ask them for a natural solution to the problem and they don't give you one and you become frustrated, that's not really their job. Number two is really just looking at the thyroid. So, again, our doctor's training is to just look at the thyroid, and that's it. And for most people, that sounds logical, right? If my thyroid's not functioning, let's get a thyroid specialist. But from my training in functional medicine, and the way that I'm able to help people that other doctors aren't able to help, is we have to look at the whole body. So just give you some quick examples of this. Many patients that come to me with a thyroid problem, I'm going to work them up completely. And one of the things I may find is that there's other areas of the body that aren't functioning that may be contributing to their thyroid symptoms or their thyroid problem. So an example would be the gastrointestinal system. They may have no gastrointestinal symptoms whatsoever. They don't think there's a problem there, but when I work them up, that's what I'm finding. And what's important or interesting is that 20% of your T4, which is one of the hormones that your thyroid makes, gets converted to T3 by those bacteria in the GI tract. And this could be a 20% decrease in thyroid function just from an imbalance, or we call dysbiosis, in the intestinal tract. So the only way I can get those patients better is I got to work on their gastrointestinal system in order to help their thyroid. And on a side note, a lot of patients that come to me with gastrointestinal problems, when I work them up, I actually find out they have a thyroid problem. Because when you have low thyroid, this can cause low stomach acid. And this can cause improper breakdown in the food in the stomach, and this can cause the food to move into the small intestine when it's not ready, and that small intestine is now not able to do its job, which sends it to the large intestine, who can't do its job, and that's a vicious cycle. But again, they might even have any thyroid symptoms that they're aware of, but the only way I can get their GI problems fixed is to work with their thyroid. Neurotransmitters is another example. So neurotransmitters, or chemicals in the brain, that help the brain communicate with itself and different parts of the body. So again, to give you a little analogy here, if your thyroid sends a signal to your pituitary, which then sends a signal to your hypothalamus, that's going to send a signal back to the thyroid to say, yeah, we've got your message. And this is called a feedback loop. And if that's not working properly, then the thyroid just keeps sending the signal, but it never gets the message that's been received. And this can actually create a thyroid dysfunction. But it's really not even a thyroid problem. It's actually a neurotransmitter problem. And again, this is the key to helping these patients that other doctors struggle with. So those are just two examples, but as you can see, in our current system, your endocrinologist isn't going to look at your GI tract, and your gastroenterologist isn't going to treat your thyroid. So again, this is why we need a functional approach to figuring out these cases. Autoimmunity. This is something I see a lot in my office. I treat a lot of autoimmune cases. Hashimoto's and Graves are both autoimmune related. And in our current system, most doctors don't even test for it because it really doesn't change the treatment. The current standard of care is, again, just looking at the TSH and recommending medication to try to normalize the TSH. If the TSH is off because the immune system is attacking the thyroid, in our medical training, they're told that, well, there's nothing you can do. There's no treatment for autoimmune disease other than Humira or other autoimmune suppressing drugs. So it's most of the time it's overlooked, and in my mind that's mistreated. The number one cause of chronic thyroid problems is autoimmune related, where your immune system is actually going haywire and attacking your own body. So there's reasons why this can happen, and in my office you need to be checked for your immune system. You need to be checked for blood sugar imbalances. You need to be checked for anemia or lack of oxygenation of the cells. You need to be checked for gut and liver function, fatty acid metabolism. And we need to figure out the root cause of your immune system dysfunction. So again, the medical world solution for this is just to suppress your immune system with steroids and other immune suppressing drugs. And often these medications will have side effects. And there is a better way. Because again, we need to address the cause of the autoimmunity. What's driving the immune system? And again, there's many, many things that we could go into, whether it's food sensitivities. And these are things where you're eating certain foods every day, and even though you may not feel an allergy reaction, kind of like eating a strawberry and your mouth breaks out, but your immune system is reacting. And every time you eat these foods, you're creating antibodies, and this is causing stress to your immune system. Heavy metal toxicities and different chemical exposures can again stress out the immune system. Something called a leaky gut, when we have damage to the intestinal lining, and this is causing undigested food particles getting into the bloodstream, and again, how it causes your immune system to have to work overtime. So we need to optimize your gut function. Again, 80% of your immune system is in the gut. This is a big area of new research in the functional medicine world. Optimize your vitamin D levels. So again, vitamin D levels are epidemic low in our society for many reasons. We could do a whole other talk on that. But again, your immune system is heavily dependent on optimizing your vitamin D. Detoxification, as I mentioned earlier, different toxic chemicals can stress out the immune system. So if you want to truly get to the underlying cause of your thyroid problem, you need a doctor who practices functional medicine. This is how I'm able to help people who couldn't previously be helped. So if you'd like to learn more about what I do and a functional approach to thyroid problems, you can go to my website at www.thyroidvirginiabeach.com. That's www.thyroidvirginiabeach.com. Thanks for watching.